Okay, just left it a couple of minutes past 2:30 so that everyone could join us, and we've got a really good number of attendees with us now. I'm Tessa Guttridge, I'm chair of Young Dementia Network, and wanted to give a really warm welcome on this grey, miserable November day to all the panelists and to everyone attending. Just to let you know that panelists will be on audio and on video throughout, and attendees won't be. So that's just to make sure that you're aware of that you won't be seen or heard, but Janet's going to offer you ways of interacting. So if you've got your mug of tea to hand, I'm going to pass over to Janet and for the Sensitivi-tea Young Dementia Network webinar.
Welcome everybody to the Sensitivi-tea webinar. It's a great pleasure to have the opportunity. Thank you, I can see everybody now. It's a great pleasure to be able to host the webinar. And thank you to Young Dementia Network for giving us this opportunity to talk about sensitivity, and particularly the focus of the session today is to talk about what matters during diagnosis. So we're going to be presenting some important data about a large study that we've conducted, and I hope that that will be of interest to people. And we really hope that people will join us in the question and answer session, which we're holding a little bit later on. And we're also going to be conducting a poll. So we'd be really grateful for quite a lot of audience participation. So we'll get started by introducing ourselves. And as you can see, I'm not the only person here on the screen. I'm really delighted to have a number of co-panelists joining me. And thank you to them all for agreeing to sit in the hot seats today. So first of all, I'll start. I'm Janet, and I'm an old age psychiatrist. I work in a memory service running a young onset dementia service in London, in Havering. And I also work as a researcher at University College in London, and I've been part of a large study on young onset dementia recently. So thank you and welcome, and I'll hand over to Mary.
Hello everyone, I hope you're all enjoying your cups of tea. So I'm Mary O'Malley and I'm a lecturer in ageing and dementia at the University of West London. I was fortunate enough to work on the large study that Janet mentioned, the Angela project between 2017 and the start of this year. Keith and Rosemary, would you like to introduce yourselves?
Thank you, Mary, and thank you, Janet. Yes, my name's Keith Oliver. I'm 64 years of age and living with Alzheimer's disease. And until my diagnosis, I was a head teacher of a large primary school, a school advisor, and studying for a master's at my local university. I live in Canterbury with Rosemary, my wife, and have 3 grown-up children and 3 grandchildren. I'm a founder member of the Young Dementia Network and a panel member of the Angela Project. And I'm extremely keen in my writing and talks to be an advocate for the cause of young onset, because as we all know, we are often heard but seldom responded to as a group.
Thank you, Keith. Chris, would you like to tell us a little bit about yourself? And Arleen?
Yeah, of course. Right. My name's Chris McFarlane. I'm also 64. I don't know what to say. Oh, I've got vascular dementia, yeah. I think, isn't it? Yeah. Sorry. We've got 1 son, 3 grandchildren who are really great, and give you a reason to get out of bed in the mornings, which is also very good. What else? I don't know.
What did you do before?
Oh, I used to work in the ambulance service until I had strokes, then they pensioned me off. But since I was diagnosed, life's actually gotten better for me in a lot of ways. So although it was it's a bit scary, to realise that you've got it. And I didn't really think to admit to myself I had it until recently, really, because I'm getting worse with my words when I just forget what I'm trying to say. So, but there we are. That's all I've got to say on the subject at the moment.
Thank you, Chris. That's really helpful. Arleen, was there anything you wanted to add?
Only that we've been under Wokingham Hospital for Chris's dementia, and they've been excellent. And he's also part of the Young Persons with Dementia charity.
Yes.
And they help us a lot, and he does their harmony choir and he plays his guitar there. So that gets him out of himself. So that's
it's really good.
Yeah.
Thank you. I'm just aware that Rosemary is sneaking into the picture as well. I'm not sure, Rosemary, we've met before. Welcome. I wondered if you wanted to add anything. I think you're on mute.
Sorry, my fault.
Yes, I've been here all the time. So, and Keith just turned the computer around so that I'm on. Yeah, I support everything Keith does. Yeah.
Thank you. So thank you everybody for introducing yourselves. So it would be helpful for the audience maybe just to help them understand a little bit more about the session today. And so as Mary and I think Keith also mentioned, we were all part of quite a large study called the Angela Project, which some people in the audience may be aware of. And one of the goals of that study was to try to understand the impact of receiving a diagnosis of young onset dementia and thinking about what matters most to people while they were on the receiving end of that diagnosis and the personal experience. And Mary will be talking a little bit about that in a minute, but to help us sort of focus our minds a bit and sort of reflect upon the personal experience, we're really grateful to Chris and Keith for agreeing to share their own personal experiences about receiving a diagnosis. And the goal is to try to help us all think together over this next hour about what matters most and perhaps how things could be done better. So if it's okay, I'll come to you, maybe Keith, first of all, to tell us a little bit more about your own personal experience. And thank you.
Sure, thank you, Janet. Yeah, and it's great that this topic is under the umbrella of sensitivity, because I think that's a key word in delivering a diagnosis. In my case, my diagnosis took place 10 years ago and began in April 2010 and ended on New Year's Eve 8 months later. This seemed an eternity at the time, but as I've discovered since, was actually quite a swift assessment for quite a high functioning, physically fit 54-year-old head teacher. The process began with the GP sending me for an MRI scan to rule out a brain tumour, as they thought my symptoms of balance issues leading to falling over, headaches, declining concentration was suggesting that as a possibility. The GP didn't tell me this was in their thinking. Following the scan, I had an appointment with a neurologist who, after a series of questions and referring to my scans on his computer screen, quite matter-of-factly told my wife and I the good news was that the scan confirmed there was no brain tumour, first shock, but it suggested that I had early onset Alzheimer's. We were stunned. We'd not seen this coming. There was no preparation for this, no support, no sense of what we were going into. The neurologist recognised this and understood my wish to have the situation explained to us. So he showed us the details on the scans and drew two sketches. One he described as a healthy 54-year-old brain, and then he drew mine. And he introduced me to words like atrophy and said that there was marked atrophy, was the phrase he used on the scan, and explained what this meant. Whilst shocked, I was keen to think and talk it through with Rosemary. So before going back to work, because I say this was a shock, we didn't know what appointment we were going for. I got lunch duty that day and spam fritters and everything to sort out with the kids. So it was a case of trying to, and a staff meeting that day as well. So we went for a walk along the beach, and I said to Rosemary, one door will close, but another one will open, and we'll face this together, which is how it's been. After more tests and a PET scan, I was discharged by the neurologist, who by this time I'd got to know and respect. I was fearful of being dumped. He explained that I was now in the hands of the memory clinic. Over the next 3 or 4 months, I attended 5 or 6 appointments at my local memory clinic in Canterbury and underwent lots of very detailed assessments and spoke to a number of staff from psychology, psychiatry, nursing. Each one was trying to add a piece to the jigsaw. I was so keen to score highly on the tests and found these appointments exhausting, so much so I would have to go to bed in the afternoon. And that the GP knew I no longer carried on working, he signed me off for periods of 2 months at a time. Each assessment by the new psychologist and her assistant was scored, and at the next appointment, I was given the results and a sense of what this meant. I appreciated the openness of this. As a professional, I fully understood quotients, and to be placed in the bottom 5th centile, which I was for some tests around recalling, was alarming to both the doctors and myself. What I didn't get was any sense of advice or suggested ways to combat my difficulties, which were being exposed by the tests. At best, I was just below average for the population, when weeks before I was running a multi-million-pound budget, employing over 50 people, and responsible for the education of 470 children, plus advising 23 other schools and doing a master's. I was exhausted. My self-esteem was badly damaged. An accurate diagnosis was crucial. When it came to the confirmed diagnosis on New Year's Eve, there was no surprise or shock, for whilst to varying degrees, Rosemary and I held hopes that as yet unconfirmed suggested diagnosis that the neurologist had issued could be proved wrong. I knew, though, in my heart, the results of each test chipped away at this hope. The diagnosis was delivered by the psychiatrist who had overseen the team, and she was supported by a young assistant psychologist who had supported me as well as conducting some of the assessments. I appreciated him giving up time on New Year's Eve to do this for me, because having this familiar, friendly professional alongside me and Rosemary meant a lot. That's it for the moment.
Thank you, Keith. That's so helpful and so it's such an interesting and a thoughtful reflection on your personal experience. I wondered if it would be possible to come to Chris and bearing in mind thinking about the personal experience of receiving a diagnosis and about what mattered most to you. And perhaps also how it could be done better. What are your thoughts about that?
Well, when I got diagnosed, it came as a great shock. And I went to Wokingham Hospital to the memory clinic, and they started explaining the situation to a group of us that had early onset. And it became obvious to me that I did have a problem at that point. It was all done very well. They were very friendly, and they only gently coerced you into trying to answer a few questions. So I was never nervous there. It was all done very well. After, how long did it go on for? 14 weeks? For 3 months or something it went on for, and doing different things. And it really did come home to me that I had a problem, but I wouldn't accept it. I just wouldn't. I couldn't believe it. So, and it stems, I believe, from when I was in the ambulance service. I had headaches, really bad headaches, and the doctor, our occupational health doctor, said to me, "Have you ever had it scanned?" And your head scanned, and I said, "No, there were no such things available." In 1974, when I got the first one, they thought they were migraines. So I was in uniform at Wexham Hospital, and I got an appointment for a CT scan. And they found a lump in my brain called an arterial venous malformation. And I saw the neurologist, and he said, well, the only way they can deal with it is to cut it out, and I will be blind because it's all around my visual cortex. So I said, well, I don't really want that. So after that, well, I went back to occupational health, and they said that one of the friends of the occupational health, her husband was a brain bloke who worked at Harley Street. Neurologist, yeah. And so I went and saw him, and there was a new process came out called gamma knife surgery. And so I had gamma knife surgery for 8 hours. I had to do it because it was about the size of an orange in my brain, and all the blood was going in there, but it didn't have anywhere to go, and that's while I was getting these severe headaches.
Yeah.
So they think that that's probably where it all started, because then I had 2 strokes after that. So and I just didn't go out of the house. I was I fell down the stairs, and I was in a coma for 4 months. And when I got home, I don't remember coming home, but when I came home, I just didn't go outside the house at all. And it was only when I went to the doctor for something. What happened?
Yeah, it doesn't matter. But
well, we went to the doctors, and he said, well, and that's when he said he'd send me over to the hospital to have a assessment done. And that was when Jackie, yeah, really good. She gave me some tests and that, and it was, although I got a lot of the questions right, there were a few that were wrong. So, and that surprised me.
You were on the borderline, weren't you then?
I was borderline.
Yeah.
I was borderline, apparently. And so, because I never went out at all, I became sort of housebound, and I was scared to go out, really. I wouldn't even go and have a cup of coffee. And but since the diagnosis and going to the hospital and joining the choir, it really it's helped me, because I've got back onto doing things using my brain. Trying to read music is really difficult now, but I can still do it. And yeah, it is a struggle, and it's still scary. I play lawn bowls, and I've told everyone there that I've got it, because I keep on, when you bowl, it can go that way or that way, and invariably I'm going the wrong way with it, and so it goes on to everyone else's rink, they're called. So I had to say to them, why? I just don't think to stop to make sure I've got the bowl going in the right direction. So everyone knows about it, and that made it a lot better at the club, because I was really nervous about it when I joined.
Yes.
but they've all been really good to me as well, you know.
All that people are aware, isn't it?
Yeah, so making people aware, that is a big thing. And I've got no problem with doing that now, you know.
Thanks, Chris. It's really helpful to learn about the impact that that diagnosis had on you, and your mental health as well, I guess.
I've suffered, yeah, I do.
How it knocked your confidence. So, I mean, and it's I guess one of the reasons for trying to talk a little bit more about this topic is to understand how different people's personal experiences can very often be. And I guess just moving on from Chris and Keith's reflections, we would really like to just open things up a little bit to the audience, because I'm guessing that there will be people with a wealth of personal experience, hopefully listening to us and this discussion. And we were going to pose a question to the audience on our audience poll, and I have to read out the question. And we're going to invite everybody to let us know their thoughts. So I'm reading out the audience poll question, and the question is, do you think the process of receiving a diagnosis in the clinic is sensitively handled? Do you think the process of receiving a diagnosis in the clinic is sensitively handled? And if you think that the process was handled sensitively, please answer yes. So yes, the process was handled sensitively. Or if you feel no, the process was not handled sensitively, please answer no. And if you're uncertain, please answer I don't know. So the question is, do you think the process of receiving a diagnosis in the clinic is sensitively handled? Yes, no, or I don't know. And we just have to wait for the results to be collated by our experts behind the scenes. We're just giving people a little bit of time. Okay, so this is interesting. So sharing the poll results with you. Do you think the process of receiving a diagnosis in the clinic is sensitively handled? 19% of our audience said yes, 40% said no, and interestingly, 40% also said, I don't know. So there was an equal response to no or I don't know. So thank you so much for sharing your thoughts with us on that. And bearing that maybe all in mind, which is a really interesting broad reflection of everybody's experience, we thought we might move on a little bit now, because Mary's going to share with you some quite important information about a large study that we did looking at experience of receiving a diagnosis of young onset dementia. So I'm going to hand over to Mary to lead this part of the webinar. Thanks, Mary.
Thank you, everyone. Yeah, it was interesting to see that selection of mixed results, and a shame to see that so many of you said that it wasn't handled sensitively. And unfortunately, this echoes with a lot of the findings that we had in the Angela project. So I thought today we could share some of the findings from the Angela project. So for those of you who aren't aware of this project, the Angela project is dedicated to a lady called Angela who was diagnosed with dementia at the age of 51. And she had symptoms for 3 years before receiving her confirmed diagnosis. So the Angela project, it took place between 2017 and it finished in December last year. But we looked at improving diagnosis and also the support that younger people living with dementia receive. And today we thought we'd share some of the findings that looked at sensitivities around diagnosis. And we did a piece of work where we spoke with younger people living with dementia and their family supporters across England. So there were 36 people in total taking part in the project. And we asked them to share their experiences of the dementia referral, assessment, and also the period of receiving their diagnosis as well. So about the language and how it was communicated. And we collected data during 2018. And from all of these reports, we were able to collate and create key statements. And these are what people said were key in receiving a diagnosis of dementia. Sorry. And what's also key in the memory services as well, and what's important to them. So to start with, share some of the key statements that came out on what people said was important about receiving a diagnosis. So people talked about convenience, about being involved in the diagnosis process, about clinicians actively listening, having meetings face-to-face in person, for clinicians to have a considerate language, having home visits, for people to have opportunities and time to ask questions, for clinicians to have a calm approach, for there to be opportunities for private discussions, for clinicians to be mindful of reactions to diagnosis, and for assessments to take place in private locations. So we're now going to share some of the quotes that we had that referred to active listening. So with active listening, this statement refers to the clinician should listen to the person with dementia and their family as a whole. And on the right-hand side of the screen, you can see two quotes from people living with young onset dementia. The top one says, "Believing me that something was wrong and not saying it was all down to stress. The process could have been improved if it had just been diagnosed quicker, and again, if they listened to us as a family." So going back to one of the other key statements that we had, considerate use of language. Clinicians should be compassionate, empathic and respectful during the assessment, and particularly sensitive when providing information about the diagnosis. So on the right, we've got quotes now from family supporters of people living with young onset dementia. The top one says, "The diagnosis was handled sympathetically and very reassuring. Being tactful and careful when discussing how quickly someone's dementia may deteriorate as well." So these two quotes offer different experiences of how language was used, and really emphasizes the importance of the role that the clinician has in delivering that information. Okay, so we also have some statements that refer to services. So I'm going to present these now on the screen. So what people told us, so GPs' recognition of young onset dementia, having enough notice period for appointments, contacting family supporters as well, having a single point of contact, avoiding repetition unnecessarily, using lay terms, having a follow-up letter following diagnosis, a quicker referral, having referrals to specialist young onset dementia services, having a multidisciplinary team, having enhanced awareness of young onset dementia, for clinicians to understand all forms of dementia, for assessments to be explained, having improved access to clinics, having a pleasant MRI experience, for results to be issued more quickly, for diagnosis to be explained, and having a shorter time to diagnosis. So I know that's a lot to take in, but I thought I'd give you a summary of what these key points were and what we found in the Angela project. So I'm now going to show you some of the quotes that refer to referral to specialist services. So people said that referrals should ideally be made to specialist young onset dementia clinicians and services. And we have a quote here from a family supporter. for referrals to be made to specialist units, better awareness and training in mental health trusts on the issues faced by young onset dementia. And I think this quote here, it links up with a few of the key themes that were on the other page. So having enhanced awareness of young onset dementia and also possibly having a multidisciplinary team. Okay, so I'm now going to show a few quotes that related to the follow-up letter. People emphasize the importance of receiving a follow-up letter. So providing the person with dementia and their family supporters with a letter which details the diagnosis. So we've got a quote here at the top, which is from someone living with young onset dementia. So to deliver the diagnosis face-to-face and then provide a subsequent letter. And the quote below is from a family supporter, and they've said, the diagnosis has difficult terminology, but this was explained, and having the follow-up letter, I was able to research and look up for reference. Okay, so we hope that that has given you an overview of some of our findings. I know it's a lot to take in, but what Janet and I are particularly, and the rest of the Angela Project team, I should say, what we're really interested in is understanding how we can use this information to improve the experience for people who will undergo a diagnosis. So I think we've got a couple of questions now for Keith and for Chris.
So thanks so much. So as you can see, the Angela Project really yielded an awful lot of quite in-depth and really valuable information.
Try the light on so I can see my script.
What we thought we might want to do, just bearing in mind that information, is just to reflect back to Chris and Keith again. And I think some important questions, because they're arising in the chat, and I guess our own experience as a research team. I guess we would be really interested to understand your views on what would have eased the experience of receiving a diagnosis, and are the things that would have helped you feel better equipped for what was to come when you were on the receiving end of that experience. And maybe I'll ask Keith first to help share his thoughts.
Yeah, okay, Janet, thank you. Yeah, well, first of all, greater sensitivity, as we saw from that survey earlier. I probably would have been on the not sure, because there were elements of it which were delivered sensitively, but other elements weren't. So greater sensitivity, I think, would be the first thing I would say. Alongside that, some pre-confirmed diagnostic counselling. So there was no real support by way of counselling during the process. Strategies to help me deal with what the tests were confirming during the diagnosis. I was given lots of information about how badly I was doing, but virtually no information about what I should do about that to try and deal with those issues. A follow-up appointment soon after to see how I was coping with the diagnosis as well as with the Alzheimer's. And I treat the two slightly differently there, though the two are intertwined. I'd like just to sort of explore them separately, because I think sometimes there is some support with the Alzheimer's, and it's more generic support, but the actual support of dealing with the diagnosis tends to be more person-centered and therefore less available. I'd like to have had a bit more positivity in the approach of professionals, not rose-coloured specs or anything like that, but just a sense of positivity. I expected doom and gloom from others, but not from those who I thought would be caring for me. For example, when I asked how long I'd got before I was in the late stages of dementia, the consultant said she didn't know, but best guess, based upon my scans and the tests, was 3 to 6 years. Well, I'm proving that wrong at the moment. Also, the neurologist offered well-intentioned advice about cancelling a forthcoming holiday to Australia. We didn't take his advice, but explained to him a bit about our previous Aussie experience, and staying part of the time with friends who were understanding of the condition, and we slightly amended our itinerary. We went, and we've been back 8 times since being diagnosed and told not to go. I think this is an example of a professional offering to wrap us in cotton wool and having very low expectations or at or immediately after a diagnosis of young onset dementia. I was also told to drop out of my master's course at my local university, which still hurts me today, as my marks were very good. There was no offer of support. The message was, we'd better call it a day. You've now got Alzheimer's. Another thing which would have helped would have been meeting other people going through similar experiences at the same time, and a named professional supporter who would be both mine and Rosemary's go-to person to navigate us through this time and beyond into post-diagnosis. So that leads me on in a way to talk about what would have better equipped me. I guess to an extent I've answered that in the first part of this piece, but having good printed information in accessible amounts and formats, but most importantly accompanied by someone to talk us through those pieces of information, would have helped a lot. Reading material in a dollop and without a person is not really good enough. Not to be told I was discharged immediately after feeling that my life and career had discharged me is also important. Nobody with any other terminal, incurable, untreatable disease would have experienced this. One thinks of the parallel with cancer, which if like my dementia diagnosed early, can lead to positive outcomes. Support for both Rosemary and I together, but also independently. I'm unsure how successful the brilliant idea of the Admiral Nurse actually is, or indeed how widely spread they are. We know the numbers are increasing, but from incredibly low baseline and still very small in number. And I know some areas have refined the way they are deployed and used. And having medical people, including both primary and secondary care, having a better understanding of young onset dementia would have been very beneficial. Awareness raising never ends.
Thanks, Keith. That's some very poignant examples there. And I guess what we're about today is a little bit of awareness raising. Chris, I wonder if I could come to you while people are just looking at the final question on the slides, which I'm not sure if Mary's put the Q&A question up yet. So Chris, sorry to come to you. I guess the same question for you, really. Keith has reflected on anything that might have eased the experience of receiving a diagnosis, and what would have helped you feel better equipped for what was to come. What are your thoughts?
Well, from the outset of being informed that I had it, the support I've had has been really great, to be honest with you. From Jackie Hussey to the hospital staff all the specialists that I saw for 14 or 15 weeks, once a week, and they went through every aspect of the issue with me. Well, and Arleen as well, because we had a separate. What was that, Arleen?
What they did is they had one section for people with the dementia, and in another room they had all the carers. So we were talking about everything that were affecting them, and everything they could do to help us to help them, if you know what I mean.
Yeah.
So it was a double whammy. So we were involved in quite a lot of it, a lot of a different experience to what Keith's had. So, I mean, most of it, I think, was supporting Chris and making sure he understood, but he was in denial for quite some time.
Well, I'm sure that different areas obviously have got different attitudes towards this issue. You know, different counties must be slightly different, but Wokingham has been really good. It really has been.
What
I mean,
else
I
do
don't
you
know
think?
what. I don't really think they could have done anything more for my mental health. If anything, it's brought me out. It's brought me back out into the world because I'm fighting it. You know, I'm not allowing it to sort of stop me. I mean, it gets you down. I mean, whenever I'm talking to anybody and discussing issues, I just can't remember. You know, I'd just say I have to keep looking at Arleen if she's there and saying, where were we? What were we doing there? Because I just can't remember. But I'm positive with it. You know, we're not letting it get us down.
We want to do.
Yeah, and I still do everything. I'm doing more now than I did, well, for the first 8 years of my retirement. That's another thing, that because I retired in 2008, in a lot of ways I was already sort of prepared, you know, for getting this. But I mean, when I was in the ambulance service, it was great, best job I ever had. And then the next day I got pensioned off because I couldn't do it anymore, which was very upsetting, obviously. But I've gotten used to that as the years have passed. And now this is the issue that I've now got with dementia is just another hurdle that I've just got to, well, I can't get over it, but I'll keep on climbing it. You know.
It's really good to hear that you had a positive and supportive experience, Chris. I know that we're going to just ask a question to the audience, but just to reflect on a question from the Q&A, if I may, and this is a question addressed to Keith, if that's okay. Keith, somebody has asked us, you mentioned that pre-assessment counselling was something that you thought could be very valuable, and they were asking you just to reflect upon what you think that could look like. I don't know if you had any thoughts on that, and sorry to catch you on the hop, but it's just a good question from somebody who's raised that in the Q&A. So pre-assessment counselling and what it might look like in a way that would help you feel better equipped for what's to come.
Sure. I mean, we you know, I could extend that to talk about post-diagnostic counselling, but that's not the brief for today. Sure. So solely to concentrate on that period, which for me was around about 7 or 8 months. I think what was really important would have been to have a contact person, one real person who I could go to and Rosemary could go to, and that was never available to us. Rosemary's reminded me this was 10 years ago, and in some ways things have improved, but in other ways things have actually got worse, as we all know, and people who are talking in the chat line are reflecting that. And I think what I would wish to see is this idea of one contact person is important, and it's just a case of because I'd never met anyone with young onset dementia, and most people going through this are in the same boat. You know, we thought it was the disease of the over 75s, and to confront this personally in a way that we did was a big hit. And I think it's great credit to not just me, but everybody who is part of this Young Onset Dementia Network, who has the condition, to come through this, because it's really down to the resilience and the support that people are exposed to and able to generate that is helping that really. And there should be some counselling to help with that. And as I say, some kind of sense of realistic positivity. What can you still do? How can we help you still do these things during the diagnosis period to start with, and then beyond? We can pick it up later.
Thanks, Keith. Thank you ever so much. I'm just aware of time, and I'm aware that there are some questions in the Q&A which we're trying to look through as we go along. So apologies if we're not so good at multitasking. I think that we might like to put up a final question, Mary, for the audience, which Mary's just going to talk us through, and we'd be happy to try and have some discussion and reflect upon that from the Q&A. So this is a question for the audience. And I guess that it's been so valuable to hear Chris and Keith's reflections on their personal experience. And we're aware that there are probably some people in the audience, for example, who work in services and young onset dementia services, working in memory clinics, for example, and for people living with young onset dementia. I guess the information that we've presented today, people's personal experience and some of the feedback from the Angela project, we're wondering how this information that we've been gathering through this large project could be useful to people. So I'm just checking in the Q&A to see if there are people who wanted to reflect upon the sort of information that we've gathered, which has helped us understand a little bit about what matters most to people, and also what services could do to improve the individual experience of receiving a diagnosis. We wondered if there were any reflections on that in the Q&A. So we're getting some information or some reflections in the Q&A about people wanting to be given as much information as possible, a little bit like Keith said about what to do next and where to go next. People asking about or mentioning the importance of having follow-up appointments after diagnosis, and some important advice about writing down every single question when you go for any follow-up appointments, so that you don't forget particular things that are important to you that you would like more information about.
Questions going. Answers. Questions.
So there's some very, very helpful information coming back from people who are in the process of reviewing local services, who were interested to learn Keith's comments about post-diagnostic counselling that could be incorporated into services to help improve the experience, and other people reflecting upon how important it is to have easily accessible information, not giving too much information all at one time. And I think that's valuable, because it certainly reflects the experience of the people who took part in the Angela project as well. Were there any further reflections from Keith and Chris upon that?
Not really. I mean, I'm very happy that Wokingham has looked after the issue so well for me.
Yeah.
So,
and I think from my perspective that all the things that Keith's bringing up, most of those were covered by the memory services we had. We had always had someone we could speak to. We always had the information we needed. They gave us a booklet with all the information in. And we then went back to discuss the booklet after taking it home and digesting it.
oh yeah, that's right. Yeah.
So that was a really good thing that I don't know if other services do. But also meeting other people that have dementia and their carers, which we were involved in doing that as well.
Got some really good friends now.
Yes.
Remember?
Yeah.
So, just being aware there are loads of things out there.
Yes. It's so helpful to hear a really positive experience, and I'm sure that's been really informative for everybody who's on the webinar today, to hear about that personal experience. There's some more reflections in the Q&A, actually, people telling us who are perhaps, it sounds like people working in memory services themselves, that very often their role is simply as a diagnostic service. and that raises the issue of people being discharged quite quickly after receiving a diagnosis, which Keith reflected on, and saying how that's helping people think how important it is that so much more needs to be incorporated, rather than just simply focusing upon diagnosis and then people being discharged. And the value of it, of recognizing how different the experience is for younger people, and how services need to be in tune to that, because people's needs and the stage of life is very different to those in later life. So some really interesting and helpful reflections in the Q&A.
Yeah,
so I'm just going to sorry, Keith, go ahead.
I was going to say, I want to hesitate from moving too far into the post-diagnostic part of the pathway, so to speak. But I think that's it's really this key period around the diagnosis time when I feel it was pretty tough. But then I recognise in the professionals the difficulties they confront as well. So, you know, my experience actually wasn't a bad one. It was a case of trying to think, how could it be better?
Yes. No, thank you, Keith. That's really helpful. I'm just aware of our time constraints, and apologies for hesitating while I'm just looking through the Q&A to pick up any more points. Yes, so many people mentioning pretty much as Keith has already reflected about how valuable information at the time is, and the right sort of information, and getting a key supporter to take you through that experience. So I think that in our last few minutes, I'll probably just hand over to Mary again, just to share with you a few thoughts about how the Angela team might like to take things forward.
Yeah, thank you, Janet, and sorry for not speaking earlier. I was muted and I couldn't find the unmute function. So yes, thank you to everyone at home who has engaged in the Q&A questions that we've had, and a big thank you to our lovely panelists, Chris and Arleen, and Keith and Rosemary, for sharing your experiences around diagnosis. I've really enjoyed the discussion today. So we hope everyone at home enjoyed this webinar, and if you did, we are planning to hold a couple of public consultations to understand how we can best use all this information that we've gathered from people's lived experiences to create some outputs that can hopefully improve the diagnostic experience that people new to the memory service experience. If this is something that you would like to be involved with, there will be information in the follow-up email that the Young Dementia Network will be sending out over the next couple of days. And in addition to that, if you would like any more information about this piece of work from the Angela Project, we have actually just published our findings, I think 3 weeks ago, in the journal Dementia. So the link to that journal article will also be shared in the follow-up email that you'll receive. So yes, I'd just like to say thank you again to everyone for joining us today with your mugs of tea, and I'll pass back to Tessa.
Well, that was so interesting. Thank you so much, panelists, and thank you to all attendees who have filled the chat with so many interesting perspectives that we really need to read through at our leisure, I think. So Mary mentioned the follow-up email, which is packed full of information about next steps, really, and publications and how to get in touch with Mary. But also look out for the next Young Dementia Network webinar, which is on the 16th of December, and that's festivities, hints and tips for coping with and enjoying the festive period. Hope to see you all then. Yeah. Bye-bye.
Okay, bye-bye.
Bye, everyone.
Bye-bye.
Bye-bye.